Hello everyone, welcome to one of our new webinar session. Today's webinar will focus on the MetiSmile FScan 2.2.5.4. So it's a software update, but the thing is the major update will be in the jaw motion module. So that will be our focus of today's webinar. Without further ado, let's dive right in. Through several clinical cases of jaw motion, we will demonstrate the workflow of the new features of the FScan 2.2.5.4 software. As you can see from this page, we can use the software to do a virtual patient scanning, like the simplest workflow for the MetiSmile face scanner. And also for the second session, we have the trajectory tracking, and we will explain that in detail in the following slides as well. And also the third main part is the jaw relationship determination. It's one of the application for the jaw motion module as well. And we will also give detailed information using real clinical cases to demonstrate and to how to use the new function, as well as the software updates for the FScan software 2.2.5.4. The first update you may notice is the order creating interface for FScan 2.2.5.4. As you can tell from this page, from FScan 2.2.3.4 to FScan 2.2.5.4, we merged the dentulous motion scan and the mandibular movement trajectory analysis into one single button on the 2.2.5.4 version. It's called the mandibular movement trajectory tracking, and you can enable the trajectory analysis in that part. The first function about the jaw motion module I would like to introduce is the mandibular movement trajectory tracking. As you can tell by its name, it can capture the trajectories and can be exported into design softwares to help with the restoration design. And it can cut off some pre-contact points and to improve the fit and functionality of the prosthesis that you designed and to put it inside the patient's mouth. And it can also combine the intraoral scan data with the DICOM data as well as the facial scan data. It can visualize the jaw motion and contact point movement, and it can help the communication between the dentists and the patient. It can also form a report, as we just mentioned, and it can be used to analyze the TMJ health situation of the patient. Inside the mandibular trajectory tracking function, we add a customized template for the dentist to use. So the user can adjust the recorded types and also the relationships of the bite according to their needs. And as you can tell from this page, we have some default movement set by the software, and the dentist can also add some customized movement for the patient. So for the default movement in the jaw motion trajectory tracking, we have the open-closing movement, the protrusive movement, left lateral, right lateral, and you can also choose the chewing movement, facet movement, and also 3 different customized movement for the dentist to use. And the dentist or the user can also set the times for the motions or movement they want to track. So set the trajectory recording times. Each recording captures a single mandibular movement. Each successfully captured trajectory is saved individually. Any invalid or unsatisfactory trajectory can be re-recorded, and that's how we managed to change the settings for the trajectory part of the mandibular trajectory tracking. As we just mentioned, the jaw relationship can also be customized, so we can use the MetiSmile or the jaw motion module. Even more specific, the trajectory tracking part to record the patient jaw position. We can use markers or scan forks to help the patient to stay in a specific jaw position, and the dentist can scan it using the MetiSmile, and the record jaw position using the MetiSmile can be functioned on the intraoral scan data that we imported in. As you can tell from this page, the jaw position record for this patient is a centric relation, and you can apply markers or use motion tracker to fix them on the upper and lower jaw. The clinician positions the patient mandible to the centric relation, and the face scanner capture and record the position, aligning the intraoral scan data to the corresponding centric relation for this patient. as we mentioned earlier, the trajectory analysis has moved to the trajectory tracking part, so it has the same button or shared button with the trajectory recording, and this slide shows the trajectory recording workflow. The first step is to import the intraoral scan data, the DICOM data, if you want to use the analysis, and also the first step has to do some preparation to put the markers on and everything. And the second step is to record the static phase, and the third step is to do the trajectory record. And after that, we have to do a resting phase scan. Then we need to merge them together to set some coordinate system, and then the DICOM data alignment and coordinate system setting, all this kind of stuff. Then you have the analysis and report. And also the trajectories that we recorded can be exported as a dual motion file, can also be used for the applications we just mentioned. For the intraoral scan data and DICOM data, first of all, the new software add a new intraoral scan format that can be accepted or imported inside the MetiSmile FS scan software. Now we supported the intraoral scan data format, BEB, OBJ, POI, and SDL. Should be recorded in the maximum intercalcipoid position. That's the requirement we put for the intraoral scan data that we want to import it into the MetiSmile for the dual motion to use. And another thing about the DICOM data is that the data segmentation and alignment, the segmented and aligned DICOM data will maintain positional consistency with the intraoral scan data. And now we support it to align the upper and lower jaw separately, because as you may notice that some of the DICOM data will using another tool to lift up the bite for the patient inside the to put into the incisor area while we are doing the scan for the DICOM file. So we now support it to align the intraoral scan data separately for the upper and lower jaw. After the data is aligned, as you may notice, the software will dissect the mandible from the DICOM file we imported in, and then the software will, according to the intraoral scan bite we imported inside, the software will automatically to change the DICOM file, the second open mouth position DICOM file into the maximum intercalcipoid position using the bite data we imported in from the intraoral scan data. And the maxilla and mandible teeth of the DICOM data will be aligned separately with the maxilla and the mandible intraoral scan data. And the DICOM data should be record the patient complete dentition, mandible, and condylar regions. That's a requirement we put for the DICOM file we imported in if we want to use the mandibular trajectory tracking and also the other functions. There is also another thing we need to pay attention to. After we put the stickers on the patient teeth surface, it is possible that the patient saliva will flow to the teeth surface, especially for the mandible. And once it's happened, we have to, the markers might move. Once it's moved, we have to retake some steps for the whole trajectory tracking or even other function steps. So in case this kind of things, or in order to prevent this kind of issues, the dentist can communicate with the patient beforehand, what kind of movement they may need to do and how many movements they need to track. And after that, we can save some time while we are tracking the trajectories for the patient. Also, there are two different options to track the trajectories. As you can tell from this page, we can apply markers directly on the teeth surface of the patient, or we can use the motion trackers. What's the difference between these two? As you can see, the markers directly stick to the patient teeth surface is suitable for healthy teeth or mild overbite and overjet patient that can still have some space for us to put the markers on, and while the patient doing the bite, the upper jaw, the lower jaw won't block the other jaws while we are tracking the movement. So it's suitable for these three different scenarios. And also Alignment, the pros is simple operation because you can directly stick the markers on the teeth surface. While the drawback is it's easily affected by the saliva, as we mentioned earlier, and causing some displacement. We need to reduce some steps, as I mentioned before. It's difficult to apply in case in deep overbite. So hence we have the second option here, the motion trackers. The motion trackers is suitable for healthy bite as well, and also some severe overbite and overjet. In these kind of cases, if the patient doing a bite, one of the jaws might block the other one, so it's not suitable to apply markers directly on the teeth surface, and we need to use the help of the motion trackers in order to track the motions while we are doing the scan. And also, the pros here is suitable for deep overbite cases, and it's also it's much more stable for the markers to attach on the surface of the motion tracker instead of the teeth surface, so it won't be affected by the saliva. And the drawbacks here is it requires adhesive fixation of the motion tracker, and it may detach if bonding is not stable, and it also requires some motion tracker scan and alignment, so more steps involved if you want to use the motion trackers, not only for the face scan but also for the not for the face scan, I mean for the intraoral scan, that we need to add an extra match data of the motion trackers to the intraoral scan data. If we choose different options to apply the markers, we have different method or requirement for that. If you choose to apply the markers directly on the patient teeth surface, as you can see, we recommend apply 4 to 5 markers on single arch. So each jaw, 4 to 5 markers. And to make sure they're displaced on the incisor area, or the front view, or the front view that can be captured by the device or the MetiSmile. In this way, we can easily track the motion while we are doing the scanning, and also check if all markers are simultaneously visible, which means the front view, as I mentioned, so it can be captured from the front view scanning of the device, and also randomly arrange the markers. Make sure they're in a zigzag way, not in a linear way, as you can tell from the pictures down below. And if you choose another method using the motion tracker, you have to apply some temporary resin if you're choosing this one, and also make sure the molar area or the rear end is stably sticked on the patient teeth surface. And in this way, we can make sure the trackers can stay stable while we are doing the tracking of the motion. And you can tell how to assemble the motion tracker by the animation down below. And also, you can see how we need to add an extra match while we are doing the intraoral scanning if you want to use the motion tracker. Now we are entering the actual scanning steps. It is recommended to apply 4 to 5 markers on each jaw. So the first step, marker quantity selection, is recommended 4 to 5 markers, as we mentioned on the previous slide, and then choose the corresponding number that you want to put on the patient arch, like single arch, upper and lower separately. And for the second step, we will do a marker recognition. So align the scanner with the patient face from the front. Maintain an appropriate scanning distance, 50 centimeter, and then recognize the preset number of the markers. And for the third step, maxilla mandible distinction, open the bite approximately 10 mm to allow the scanner to separately recognize the maxilla and mandible. Ask the patient, then we can enter the fourth step. Ask the patient to return the original occlusal position captured in the initial intraoral scan, and then the software will then check the occlusal consistently. We just finished the first step of the static face scan, that is the tracker creation. Now we are entering the alignment stage of the static face scan. On this stage, it will do a zero position recording. That's the first step. Align the scanner with the front of the patient face, capturing data for 2 seconds to record the starting position of the movement trajectory. So that's the first step we'll do. It's included inside the one single scan. Just the first 2 seconds, make sure you keep stable at the zero position to let the scanner to capture the marker position first, and then we can start our face scan. After capturing the static face scan, the software will automatically align the intraoral scan data with the facial data in the teeth region, which means the intraoral scan data we imported in will be aligned with the dissected teeth part of the facial scan we just did. So once the alignment is done, it can quickly preview the alignment result to reduce the patient waiting time, and it can also real-time visualization of the mandible and maxilla movement during the trajectory capturing. What does it mean? It means that because we pre-aligned the intraoral scan data with the facial data now, or with the markers, you can consider it as alignment with the markers we just put on the teeth surface. And then while we are tracking the markers, the software can simultaneously show the movement of the intraoral scan data instead of just the markers. So this is the two result will be brought by the alignment in this stage. And if the alignment result is like unsatisfactory, if you're not happy with the alignment result or automatic result, you can perform a manual alignment after post-processing the facial scan data. Now we can officially enter in the trajectory recording for the mandibular trajectory tracking part. So keep the scanner still, align it with the patient face. So make sure it is the camera is looking directly at the front view of the patient face, and then maintain an appropriate distance, scanning distance, guide the patient to perform the mandibular movement to record the trajectory. And you can see we have animation displayed on the interface to guide the patient how to do the movement. And before removing the markers and proceeding with the next scan, replay the recorded mandibular movement to check if the trajectory is well captured and to fit the suit you need. And if it's an unsatisfactory recording, you can do a re-record. Since we mentioned that the new software will allow us to set the times for trajectories like in a customized way, so it is recommended to record single complete movement for each set of trajectory. And for trajectory analysis, it is advised to record one set of the trajectories for each type of movement. But when you want to export movement trajectories to design software for restoration design, multiple sets of trajectories can be added to provide additional reference. So you can make it like maybe 3 in order to support the design of the prosthesis that when you imported the trajectories inside the design softwares. As I mentioned earlier, if we put the trackers directly on the patient teeth, there is a possibility that the trackers may move, which means if it's moved, we have to retake some steps. And inside the new software, we can recreate the tracker, or as mentioned, the tracker needs to be created a while before we start the whole scanning process. So we can recreate the trackers if the markers are moved. During the trajectory recording, some markers may shift due to saliva, which most commonly occurs in the mandible. Remove the displaced or moved markers and reattach new markers. Then use the tracker recreating function to recognize the markers. As you can see from this screen recording, the tracker recreating button is at the right bottom part of this interface. And then once you clicked it, only mandible markers can be adjusted. Before recreating the tracker, ensure the patient is in the maximum intercostal position. If the maxilla markers are displaced, start marker recognition again from the static face step, which means at the very beginning, not inside the trajectory tracking part. Now we are at the trajectory tracking part to recreate the tracker if it's moved. When we've finished all the trajectory tracking, we can do a resting face scan. As you can see from the screen recording here, make sure the patient is at rest position and do a resting face scan to save the facial data for the coordinate system construction afterwards. So this is the resting face scan. You can cut off some unnecessary data and also trim the facial data to an ideal position, and then we can use the resting face for the following steps, which mainly will be used for the coordinate system. And also the resting face can be aligned with the with the facial data with the retractors on, and we can check again with the intraoral scan data alignment. So we can not only align the intraoral scan data with the facial data with the retractors on, and we can also align two face together, the resting face scan with the static face scan that we just did. To this stage, we have finished the trajectory tracking and also the all sorts of alignment for the facial data to the intraoral scan data and all this kind of stuff. Now we have, if you want to use the trajectory analysis function inside the GeoMotion module, you have to do a DICOM alignment and coordinate system setting. So as you can see from the left screen recording, we can separately align the upper and lower jaw to the DICOM data inside the new software, and according to the byte data we imported in with the intraoral scan data, the software can move the dissected DICOM file into a byte position that is suitable for the software, and after that we can set the coordinate system according to the DICOM data to condyle points, and also 3 different planes can be set using the resting face scan at the very last step of the scanning part, and we need to set the mid-sagittal plane, the horizontal plane, and also the coronal plane. With the help of 3 different planes, we can project the movement of the condyle points of the patient into these 3 different planes, so we can see the trajectories for analysis. After setting the coordinate system, we can project, as I just mentioned, the 2 different condyle points to the 3 different planes. As you can tell from this page, this patient has a irregular condyle point movement. So 2 different points has different movement inside this one single trajectory recorded, which means it's not a healthy trajectories or not healthy joint for this patient. So you can visualize the temporomandibular joint movement trajectories to assist clinicians in diagnosis, and also you can see visual tools to communicate complex dental concepts with the patient, make them easier to understand what is going on the joints or mandible. And this is how the trajectory analysis looks like when we exported the report from the software. As you can see, the left, inside the green circle is the real patient we recorded, and also inside the blue circle is a healthy mandibular movement trajectory. So the left and right condyle exhibit similar path during the opening and closing movement, no noticeable delay or restriction on either side. Indicating the good bilateral EMJ coordination. And while for this patient, the green circle, the patient mandibular movement trajectory, the left condyle trajectory appears abnormal. The trajectory shows signs of jittering or instability. The range of movement on the left side is noticeably smaller than the right side, as you can tell by the numbers we put on this report. Since we finished all the tracking, scanning, and all this kind of stuff, now we can export to design software to use the data we collected to help with the design. We can export the GeoMotion file. So the file will be named as JawMotion, this format, to be able to, it can be imported into ExcelCAD to help with the design, as you can tell from the screen recording on the right side. So this is a imported JawMotion file, so it can help with the design of the restorations to cut off some pre-contact points to improve the fit and comfortability if it is delivered to the patient mouth. So once the mandibular trajectories are recorded, now by incorporating real movement of the trajectories, optimize the restoration morphology, contact points, and guiding surfaces to minimize occlusal interference and also enhancing the chewing efficiency and the comfort for the patient. This is how it looks like if we want to use the trajectories to help with the whole design process. Once the trajectories are recorded, we can import it into ExcelCAD to help with the design, and by incorporating the trajectories or movement that we recorded specifically designed for this patient, we can cut off some pre-contact points and also improving the fit and comfortability when it is delivered inside the patient mouth. So this is a real patient case, and you can see the trying on the chair side, and there's a minimum adjustment required once it's delivered inside the patient mouth. Apart from the normal face scan and the mandibular trajectory tracking and analysis function, we now have a third main function to introduce, that is the optimal jaw relation. Face scanner as a tool for digital dentistry, it can help the dentists to reaffirm the jaw relationship of the patient. Here we have three different cases for the application of the optimal jaw relation function. For those who have severe teeth wear, and we can use the optimal jaw relation to reaffirm or recreate the jaw relationship for the patient and create a splint to adjust a bite for the patient. And for full mouth fixed implantation cases, especially for immediate loading, we can use it to reconstruct the jaw relationship for the patient, and it can be used for the design of the temporary prosthesis. And for removable dentures, because for removable dentures, the case is the same with the fixed implantation cases. The patient doesn't have any usable jaw relation. For instance, for those kind of patient, we can use the optimal jaw relation to reconstruct the jaw relationship for this patient in order to design the dentures. The first case here shows a real case for optimal jaw relation application, that the patient with severe teeth wear or teeth tear. As you can see from this workflow here, this shows the whole workflow for this patient. For the scanning device, we have to have the intraoral scanner to get the intraoral scan, and then we can use the optimal jaw relation function inside the JawMotion module to recreate or to recalculate the optimal jaw relation for this patient. And using the new position exported, we can import it into design software to design a splint, or we can use the splint design software, the Splint, inside the MetiSmile software to create a splint STL file for the patient. And once the splint is created, we can use the AccuFab printers to print it out. And we have a resin material specially designed for the splint print. And we can use the hyperclear solution to reduce the post-processing time for this kind of applications. And we have a FabCure N2 to give a very polished look after it's being cured, and it can be delivered to the patient right afterwards. So here's an overview for this case, or for this patient. The patient used the markers directly sticked on the surface of the upper and lower jaw, and using the scanner to do a zero position scan, which means it's the first step static face scan is similar with the previous function we just mentioned. And then we will do alignment between the intraoral scan data imported in and with the face scan data, the static face scan data. Once the alignment is done, we can go to the second step. That is the trajectory record. So we will ask the patient to do over 30 times small closing and opening movement to record the trajectories and then to set the horizontal relationship for this patient. With the intraoral scan data and the horizontal relationship, we have the third step, that is the freeway space calculation. That is for the vertical distance. Once we have the horizontal relationship and the vertical relationship of the upper and lower jaw, we can combine them together to form the new position. So once we have the freeway space, we can rearrange or adjust the upper and lower jaw position and to get a new position. So the fourth step here is to do a resting face and alignment scan, and then we can set the coordinate system based on the resting face we scanned. After that, it is left for the pre-designed interface to adjust the position for the patient in order to get a healthy freeway space and also choosing the right trajectory for the patient. Once we have the horizontal and the vertical, combine them together, we get the new position to design the splint. To put the overview in more detail, the first step is the static face scan, which means it's the preparation stage. For this patient, the dentist chooses to apply markers directly on the patient upper and lower jaw, not only just on the teeth surface, because as you can tell, some of the markers are put on the gingiva area. Just make sure the gingiva is as dry as possible in order to make the stickers or markers firmly stick on the surface. So apply 4 to 5 markers on single arch, as we just mentioned. Check if all markers are simultaneously visible. Randomly arrange the markers, not in a linear way, but in a zigzag way, to make the scanner easier to capture, to recognize the markers on the teeth surface. Apply markers on the gingiva, as we just mentioned, to ensure the gingiva is sufficiently stable. That's one thing, and also make it as dry as possible. Then check if the markers are firmly attached. Once it's moved, you'll have to remake some steps. Or for the deep bite, you can also choose to use the motion tracker. In case of some deep bite, markers on the lower teeth and gingiva may not be visible, we can use the motion tracker instead. Also, for the static face scan, we need to set the zero position for the patient. So in this step, we need to record the zero position for the following trajectory tracking or the jaw relationship adjustment. So this is the zero position for that. And make sure the bite is recorded in maximum interconstipation. And as you can tell from the recording here and also the pictures here, for the static face scan, make sure the patient is in this interconstipal position, ICP, and the intraoral scan data will look like this. This is the zero position for this patient. And once it's aligned with the facial scan data, once the alignment is done, this is the zero position or the zero position for the trajectory tracking and also the jaw relationship adjustment. And now we can enter the trajectory recording part for the optimal jaw relation. Before we get into the details of this part, I just want to mention one thing. The trajectory recording here is a little bit different compared to the mandibular trajectory tracking as we just mentioned. There won't be any protrusion, left lateral, right lateral, this kind of fancy movement to be recorded. The trajectory recording here are referring to the small closing and opening movement of the patient mandible. And we will record over 30 times for this kind of trajectories. So this is the difference between this trajectory recording with the previous mandibular trajectories that we mentioned earlier. So before we get started of the recording, the preparation part we need to do before recording, we can do a muscle relaxation like what we show on the right side, and also the patient should relax the muscles before the scanning to minimize the influence of the muscle memory on the recording. And for the motion training, if the patient should perform a small mouth opening and closing movement and quick occlusion movement to ensure the stability of the trajectory, at least 30 times movements should be recorded and completed before recording. After recording over 30 times small closing and opening movement, we now will go to the horizontal relationship, which means we will use the 30 times small and closing movement to find the horizontal relationship for the patient. So don't get tricked here, because the movement here is moving vertically, but still we are using the trajectories here to find the horizontal relationship for the patient. So observe the patient's open and closing movements and provide a real-time feedback to correct the following issues. Excessive mouth opening range. So we are asking a small closing and opening movement, which means the condyle here will do a rotation instead of rotation and a slight movement. Opening and closing too slowly, and also abnormal mandibular movements such as protrusion during closure. So open and closing trajectory will be recorded, as you can tell from the pictures down below, and occlusal reference plane will be set. You can tell the back, front, left and right side of the patient head. It is a direction for you to find the trajectories that you may need or the patient may need to do the splint design. And also the trajectory plane intersection point will be showed on the interface. You can see the orange, blue and green dots on the occlusal reference plane. That's the intersection points of the trajectories with the occlusal reference plane. And now we can find the new position, and the software will pre-pick a most repeatable position for the patient first. And if you want to adjust, you can select any points on the interface, and that would be the new position or new horizontal relationship for the patient, or the relationship of the horizontal relationship, healthy horizontal relationship for the patient. After the small and closing movement, we will capture the Freeway space. The Freeway space is for the vertical relationship of the upper and lower jaw. Determine the current Freeway space by measuring the difference between the vertical dimension at rest position and vertical dimension of occlusion. Repeat VDO and VDR measurements 3 times each. Before each movement, move the mandible to ensure the repeatability and reliability of the result. So the software will automatically calculate the average value for the 3 times recording of each position, and it will calculate the Freeway space for the patient. Now we have the Freeway space calculated for this patient, that is 5.3 millimeter, and we need to know how much distance we need to increase, or vertical dimension we need to increase for this patient. Now we need to use something simple mathematics. The increase in vertical dimension equals the current Freeway space minus normal Freeway space. The normal Freeway space range, here we are referring to the range of from 2 millimeter to 4 millimeter. Normally we will make it into 2 millimeter. So for this patient, the distance we need to increase here is 3.3. We use 5.3 millimeter to minus 2 millimeter. Now we get the result, or the vertical dimension that we need to increase for this patient is 3.3 millimeter. And once we type the number inside it, the software will automatically to increase the vertical dimension for this patient, which means it will increase the distance between the upper and lower jaw. As we just mentioned, we recorded a 0 position for this patient first, the intercostal position during the first static phase scan. So according to that scan, the software will increase the distance for the patient now. and it will increase it into a normal Freeway space range. After that, we will do a resting face scan. For the resting face scan, it's pretty simple and straightforward. Just do a face scan because we need to use this face to set the coordinate system for this patient. Make sure all feature points on the front part are calculated, and also make sure both ears or from left ear to right ear, the data in between or the facial data in between were all calculated. That's how we need to use the resting face to set the coordinate system. Before we set the coordinate system, we still need to finish the alignment between two different faces, the face with retractors on and also the face without, which means the resting face we just scanned. And for this patient here, we are using the manual alignment. Normally, the software will do a automatic alignment first, and you can check the alignment quality by turn on the color map or heat map to check the deviation value for this alignment result. Once we finish the scanning for the resting face, we need to set the coordinate system, and there are two important planes that we need to adjust. That is the mesoastral plane and the tragus plane. And once these two different planes are adjusted, the tragus plane is the occlusal plane that should be approximately parallel to the tragus plane. So that's why we are setting these two different planes. Once these two different planes are set, we can go on with the following steps. So also the feature points will be pre-selected once we enter this interface, and there can also be manually adjusted. You can select and drag it to the position that is much more ideal for this patient. I mean, the feature points to put it into the place that it belongs to. The previous steps are for data capturing and also the coordinate system setting. Now we are actually entering the adjustment steps. For the vertical dimension I just mentioned, we are using the Freeway space as a reference to help us to adjust the vertical dimension of the upper and the lower jaw for this patient. We get the Freeway space for this patient is 5.3 millimeter, which means it's not healthy because the normal range is 2.0, so we can use the 5.3 to minus 2.0 millimeter. We get the distance we need to increase, that is the 3.3 millimeter, and we can type in the 3.3 on the left side of the interface here, as you can tell from the screenshot underneath it. Once we type in this number, it will move the mandible downwards to increase the upper and lower jaw distance. The value here is 3.3 millimeter. Once it's adjusted, which means the Freeway space of this patient has adjusted into a healthy range. The green point here is the intersection between the most repeatable mandibular movement trajectory, the 30 times we just recorded as calculated by the software, and the occlusal plane. It represents the current adjusted horizontal position of the mandible. So you can click the blue points to select alternative trajectories and adjust the horizontal mandibular position. The vertical distance we increased here will follow the trajectories that we selected, which means the trajectory which the green dot belongs to. Hence, I need to explain the horizontal relationship for this patient here, or for this module. So we just mentioned we can see a lot of blue dots and one green dot and also one orange dot. It is the trajectory intersection part with the occlusal plane. So we can see a lot of dots here. So the green dots means the trajectories that you select as the horizontal relation between the upper and the lower jaw for this patient, which means that's the trajectories you select to let the patient's mandible to move along with. So that's the horizontal relationship between the upper and the lower jaw. And also you can change it to any blue dots here. And for the first step here, to observe the mandibular movement trajectory capturing to see whether it is stable or not. If it is stable, you can analyze the trajectory plane intersection points, and then you can select the most repeatable movement trajectory. Normally, the software will select the green dots, which means the most repeatable movement trajectory automatically, but you can also adjust it to suit the patient. We just explained that all the dots here are the trajectories intersectioned with the occlusal plane. So they're displaced as dots here. Actually, they're the trajectories that we need to select, which means this is the horizontal relationship of the patient's upper and lower jaw. We also have some additional reference here for the patient who has healthy jaw movement. The dots will be displaced in a very close way. They will stay close to each other. But for the patient who has unhealthy joint or unhealthy movement, you can see the trajectories collected using this method. It will be displaced, or all the trajectories will not stay closely with each other. So we have two different reference points. That is the orange one and the green one. The green one is the most repeatable trajectories we need to select. But the orange one, you can tell from the back, front, right, and left directions of the patient head. So you can see the orange one is the trajectory that at the very back of this 30 times trajectories we recorded, which means the distance, and we have the reference here, that is the distance between the yellow point, the most posterior trajectories we recorded. We will consider the most posterior trajectory as the trajectories that is relatively stable, which means it's not pointing left or pointing right on this stage. So we are using that as a reference point, and the green point we selected, this is the selected trajectories, will less than 0.5 millimeter. So it can be a reference for us to select or adjust the green point, the most repeatable trajectories for the patient. After setting the vertical distance and also the horizontal relationship between the upper and lower jaw, we can use the section mode here to verify the restorative space. So you can see from this page here, it will do a sectioned mode for different areas, and you can also drag the section planes to different places that you need to verify, and to make sure there is enough space after the adjustment, there is enough space for you to design the restoration for this patient. After finishing all the steps, the software will save a new position for this patient. So the picture on the left side, that is the original bite for this patient, which means it is unhealthy and the patient has severe teeth wear. So we will adjust it to a new position now, and to use the new position to design the splint for this patient, and the patient can use the splint to get used to the new bite and then wait for the restoration afterwards. Inside this module, we also have a crease splint function embedded inside it. So we can click to activate the crease splint here, and once we entered the crease splint, the software will automatically use the data or the new position we set, and we can do some customized setting for this patient, like different style of the splint, and also the occlusion thickness, and wall thickness and the undercut angle and also space for this patient. You can choose either you want to put it on the upper jaw and lower jaw or just one single jaw for us to place it on for the splint design. Once we enter the splint, the software will automatically generate it, and afterwards we can also do some menu adjustment after the automatic generation. And if you think and also we can use the configure virtual articulator and to do some adjustment to change or to see whether it is fulfill our requirement for this patient for the splint, and we can also do some dynamic cutting for the splint for this patient. Once it's done, we can smoother the surface and using the free forming tool to adjust it to suit the needs of the patient. Once it's generated, we can add some text to it, or we can send to the printer to do the printing directly. Once the design is done, we can using the 3D printer to do a 3D printing for the splint that we designed. And inside the video here, we are using the AccuFab F1, the newest shiny 3D printer, to do the printing for this application. And we're using the splint resin material to do the printing. Once it's finished, we can use the nitrogen curing unit to cure it, to give it a polished look, to reduce the post-processing time, of course. And you can see the final result on the right side picture. This is the real splint that we printed out for this patient, and you can see the polished look after the curing unit, the nitrogen curing unit done its job. The previous case we just shared, which means the case 3, is the application of the optimal duration for severe teeth wear, teeth tear for the patient to create a splint. And now we have case 4. It also falls into the category of the optimal duration applications, but it is for immediate loading of O-on-X cases. So as you can see from this page, for the immediate loading procedure, we need the intraoral scan, which means the oral scan Elite and Elite Wireless, to capture the implant position for the first step. And now scanning the soft tissue, and we'll also prepare the trackers data for extra alignment with the intraoral scan data during the intraoral scanning stage. And after that, we can use the MetiSmile to get the optimal duration with the help of the motion tracker. The steps would be the same or similar, not the same, but similar. And after that, we can export the healthy bite or the new upper and lower jaw relationship to the design software to design the temporary for this patient. And also the STL file can be printed out using Shiny 3D's resin material, AccuFab F1 for this patient. Also for this case, we're using the FabCure N2 to get a polished look of the temporary of this case. And you can see the 3D printed temporaries of this patient on the left side of this page. For the immediate loading case, if you want to transfer the pre-op bite to the post-op, it's going to be difficult because some patient lacking the teeth for quite a long time. There is no healthy bite relationship, even it's pre-op stage. So using the optimal duration function inside the jaw motion module, we can quickly recreate the bite or healthy jaw relationship for this patient after the surgery, and it can increase the efficiency of the whole digital workflow. It can reduce the waiting time of the patient, and once we recreate the new jaw relation for this patient, it will be based on the trajectories of the patient, so it's going to be much more comfortable for the patient. And once the temporary is done, or once the design is done, while we are doing the fitting, there is minimum adjustment required to this patient new teeth. Before we get started with the actual scanning, there is a lot preparation we need to do for this case. So the first of all is the intraoral scanning and implant position capturing. We will use Aeroscan Elite Wireless combined with high accuracy CodeScan body to get the accurate implant position and also the soft tissue scanning data for the design. And after that, we need to prepare the jaw relationship function. That we need to prepare the tools. For this case, since we are only doing the immediate loading for the upper jaw and there is still natural teeth remained on the lower jaw for this patient, we will use two different motion trackers here. For one thing, for the upper jaw, we will use the screw retained jaw motion tracker. For the lower jaw, we will using this like cement jaw motion tracker, and we will using the temporal resin material to secure it on the lower jaw of this patient. And with the module, make sure it's authorized. And this is the MetiSmile Optimal Jaw Relation module. Once we finished the data capturing and preparation, we need to prepare the 3D printing chairside 3D printing solution for this case, and also post-processing units. So for this case, we used the F1 printer or cell. You can use it for printing for the chairside solution, and also FabCure N2 for the nitrogen curing, or just normal standard FabCure 2 to do the post-processing curing unit for the post-curing step. And for the materials, we have the temporal resin material here. And for this kind of case, if you want to deliver it on the chair side, you have to ask the designers on standby mode. Once you finish the capturing of all the data, and once you send to the lab or send to the designer or the technician, they can get the design as soon as possible and return it in a short time. And then you can using the printer solution to do a chairside printing and delivering in a very high efficiency. Now, after the overview, there is the actual detailed steps of the case or for this procedure, for this workflow. The first step is the soft tissue scan. Because it's an immediate loading case and we're using the CAP scan bodies to help with the whole scanning process or the alignment between the coded scan body with the soft tissue. So while we are scanning the soft tissue, we will put the CAP scan bodies on and scan the CAP scan bodies along with the soft tissue. Once the CAP scan bodies are recognized, we can end the scan, and after that, the data will be used for the alignment, or the CAP scan body data will be used with the help the alignment between the soft tissue and the coded scan body. And also the soft tissue data we collected will be used for the design of the temporary. After we capture data for the soft tissue, now we will move to the bite scan. For this case, there is no bite scan needed, but the dentists just want to be safe, so they leaved a bite scan using the patient lower arch with the CAP scan bodies to get a rough bite scan for this patient just in case, and also just for comparison between the result from this bite scan with the optimal jaw relation bite, to compare these two designs to test the fit and also the quality of the optimal jaw relation result. So this is a rough bite captured for this case as a plan B. After we get the soft tissue and also the bite, we will move to the implant position capturing. So this is a familiar concept for the four of you maybe. And with the help of the Aeroscan Elite and Elite Wireless and also the high accuracy coded scan body, we can get the implant position captured precisely and accurately. We are now using the intraoral photogrammetry technology to capture the implant position for this case. And since we mentioned we're using the help of the CAP scan bodies, once we finish the scanning for the implant position, the software will automatically merge the implant position where we captured with the soft tissue we just captured. And then we can do a converting from the normal coded scan body data into a scan body data of the brands that we are using for this case. Until now, all the intraoral scan data has been captured. We have to prepare the motion tracker for this case. With the help of the motion tracker, we don't need to stick the markers directly on the upper and lower jaw of the patient, because it's not possible for us to stick the markers firmly on the upper and lower jaw for this case. So the brown silicone rubber for the maxilla, blue silicone rubber for the mandible, and the fixation method to use a screw-retained motion tracker for the maxilla, and also the cemented jaw motion tracker for the mandible for this case specifically. So you can suit the needs of each specific case to use different motion trackers or different method to stick the markers on, and to prepare screw compatible with the same kit as the coded scan body for this case. As for the motion tracker, we recommend to secure the silicone cover using a temporary resin with the main part of the motion tracker to make sure it is stably sticked with the main part of the motion tracker. As for the markers, firmly apply 4 to 5 markers on the silicone cover to ensure the stability, and also ensure the marker layout on the maxilla and mandibular motion trackers is different. As you can tell, for this case, we put 5 on both jaws. Like for the upper and lower, we choose 2 different layout for the upper and the lower jaw in order to make the software to recognize which one is upper and which one is lower, because it's different marker layout. And also for the upper and lower jaw silicone rubber, as we just mentioned, 2 different colors, one for upper and one for lower. The rubber feature has different layout. If you follow the instruction of the rubber feature to put it on, it adds a different marker layout in order to let the software to recognize the upper and the lower jaw. And you can also put into the small dent or small dents we made on both upper and lower jaw rubber features. So it's going to be different, and it can be recognized by the software easily. This page shows how to fix the motion tracker inside both upper and lower jaw. For the upper jaw, we said that we're going to use the motion tracker using the screw retained for this patient upper jaw, because it's a media loading case and there's MUAs installed for this patient already. And also for the lower jaw, because there is still natural teeth remained, we are using the cement motion tracker on using the temporary resin on the patient lower jaw. And just make sure the motion tracker is safely secured or stably secured on the patient lower arch, so it won't fall off while we are scanning the data that we may need during the whole process. Before we get into the actual face scan stage, there is still one thing we need to do while we are using the intraoral scanner, that is the extra match. So we need to do a motion tracker scan for the maxilla and also the mandible. As you can see, we go back to the previous stage that we already scanned the upper jaw. And on the right upper corner, we have an extra match function. Choose abutment scan and also choose scan to scan the maxilla area and also the connected motion trackers, the front surface of the motion trackers. Then we can use this set of data to align with the maxilla we already scanned. So once it's aligned, we can use it for the tracking afterwards. The same steps applied for the mandible as well. So we need to scan the part of the teeth data or part of the intraoral scan data of the mandible and also the front surface of the motion tracker. Once we get this set of data, we can align it with the mandible intraoral scan data we already scanned. And once we merged these two sets of data together, we can use it for the tracking later. And one thing I need to mention is that if the motion tracker fall off during the process of the motion tracker or of the face scan process or any other steps, we need to rescan all this part all over again. Just jump back to the intraoral scan data and to rescan it. If we reattached it, we need to rescan it and to set a new alignment and then use it for the face scan afterwards. Now we are officially entering the face scan stage. So the first step is still a static face scan. So once we import it into the intraoral scan data, you can check the pre-aligned motion tracker with the intraoral scan data, and then we choose the optimal duration for edentulous case and save, then click scan. We can enter the static face scan page. The same with the previous case we just mentioned. For the static face scan, we need to type in the marker quantity first, so that the software can recognize the markers we put on the patient motion tracker for this case. And once it's recognized, you can do a small movement of the mouth to let the software to recognize which is upper jaw and which one is the lower jaw. During the static face scan, we can record the zero position for this patient. So for the immediate loading case, the intraoral scan data we imported in normally won't have the bite data for this kind of case. So the upper and lower jaw and no bite data. So we can use the static face scan to set the zero position for this kind of patients. As you can see from this case, we're using the facial measurement, which means the facial proportion method, to set the upper and lower jaw at a rough vertical distance. Then we can use the static face scan to record a new zero position for this patient. The software will recognize the upper and lower motion trackers, and as we just mentioned, the motion trackers are aligned with the upper and lower jaw data already. So which means once the upper and lower motion tracker are recorded, the new zero position of the upper and lower jaw for this patient will be recorded as well. And this is the rough vertical dimension for this patient. And also we can use the rest position to do the calculation, all this kind of stuff. But for this case, we are using the static face scan to record the zero position, which means to record the rough vertical dimension for the patient first, and then we will go on with the following steps. The same with case 3, we recorded the static face scan, and then we need to ask the patient to do over 30 times more closing and opening movement to get the trajectories, which means to calculate the horizontal relationship between the upper and lower jaw. During the static face scan, if we recorded the zero position at a rest position, we need to raise the mandible by 2 to 4 millimeter, which means the healthy freeway space range, because we are using only the rest position as a reference for the upper and lower jaw. So we need to lift it up by 2 to 4 millimeter to find the rough occlusal, which means the vertical dimension of occlusion distance for the upper and lower jaw. For this case, we're sharing with doing the static face scan by placing the upper and lower jaw using the facial proportion method, placing the upper and lower jaw at a rough healthy vertical dimension of occlusion. Then the intraoral scan data will be aligned together with the motion tracker. Before we get into the 30 times more closing and opening movement, still we need to help the patient to relax the muscles and small range opening and closing movement, mandibular hinge movement. assist the preventing mandibular protrusion during opening and closing. Place both hands on the left and right of the condyle areas to ensure hinge movement. And during the jaw opening and closing, prompt the patient if any deviation occurs. Once all the preparation has done, we can start at the over 30 times small closing and opening movement for the patient. As you can see from this screen recording here, the dentists are using both hands to feel the movement of the condyle area to make sure it is doing the hinge movement, and which means it's the small and closing movement of the mandible. And we recorded over 30 times. And for this case, I think it's roughly 40 or so times of the trajectories, and to let the software to select the most repeatable trajectories for this patient. After the trajectories, 30 times small and closing movement trajectories are recorded, we still need to do a face scan for the patient to help us to set the coordinate system to help with the calculation and adjustment during the pre-design stage. Now align two faces together, the face with the motion tracker and the resting face we just scanned, and to check the alignment quality by checking the heat map or color map, and also to adjust the planes, the same as the previous case. Adjust two different planes and adjust the feature points. Then we can let the system to set the coordinate system for the patient. And the software will based on the feature points and planes we adjusted right now to set the coordinate system to help with the adjustment. So there are two different points involved. The A point is the lowest point of the maxilla, and also the B point is the highest point of the mandible. And then the software will automatically create a coordinate system for this patient. For the vertical dimension of this case, because we mentioned that we recorded a 0 position at the very beginning during the static phase scan, so this patient has already had the rough vertical dimension of occlusion at the very beginning using the facial proportion method. So for this time, we don't even need to adjust the upper and lower jaw distance using the pre-designed tools to lift it up or to close it up. For this case, the first thing we need to do is to evaluate the available restorative space. So by checking the sectioned areas, so we can check whether there is enough distance for us to do the design of the upper jaw for this patient. And the third step is to adjust the vertical dimension if there is not enough space for this patient. As you can see from the screen recording underneath this page, you can increase the vertical dimension if you type in a positive value inside the box, and if you type in a -2, it will lift the mandible up, which means it's using to close or to shorten the distance between the upper and lower jaw by lifting the mandible up if you type in a negative value here. But if you type in a positive value here, it will drop down the mandible, so hence it increased the distance between the upper and the lower jaw. So just make sure you don't get confused by this operation here, but you can always check the changes happened on the models displayed on this page. So you will see whether it is closing the distance, shorten the distance, or increase the distance. And you can see the trajectory plane intersection points and also the occlusal reference plane for the horizontal relationship. Similar with the previous case, we can select the horizontal relationship trajectory for this patient. Using the over 30 times small and closing movement, the software will pre-find a most repeatable position for the patient, and you can evaluate and to change it or to just keep it as the most repeatable position, the horizontal relationship for this patient. So the step is to observe the mandibular movement trajectory capturing for this patient. If it is consistent and stable, then we can jump to step 2 to analyze the trajectory plane intersection path. So you can tell the trajectories or the movement of the mandible is stable and consistent. Then we can keep the green dots as the most repeatable position for this patient. So that would be the trajectory that we selected for this case. Also, that would be the healthy or ideal horizontal relationship for this patient. As we talked about, if the patient has a unhealthy movement of the mandibles, so you can see you can tell by the trajectories that we collected. The case we showed on this page, the patient prompt to move the mandible towards the front left side. Hence, you can see a lot of dots are not close to each other, even though it will mislead the software to select the green dots in a wrong trajectory. Hence, we need to readjust it according to the reference of the orange or yellow dots to select the points that near to these yellow dots to make that as the healthy horizontal relationship for this patient. So this is the additional reference we just mentioned earlier. This is the same page as the slide that I showed earlier. It's an additional reference using the orange dot. The yellow point or the orange point is the most posterior trajectories recorded, and to make sure the distance between this yellow point or yellow dot with the green dot within or less than 0.5 millimeter. Once all the settings has done, we can check the section mode to see whether there is enough distance for us to design the prosthesis for this patient. And as you can see from the screen recording here, we are checking 4 different areas to see the distance, whether there is enough space for the lab or for the technicians to design it. And once we click confirm, the new position will be recorded and saved inside the software. And once we entered the pre-design stage, we can put all the informations at one page to check whether the data we collected are ideal enough for the dentists or for the lab technicians to do the design of the teeth or the prosthesis. Okay, in conclusion, as we mentioned earlier, the detailed steps for this immediate loading case, we used the Aeroscan Elite series to get the accurate implant position. Also, we add an extra match of the motion tracker to the intraoral scan data that we collected. And after that, we used the MetiSmile, the jaw motion module, the optimal relationship module function inside it to be more precise to get the healthy bite or the optimal jaw relation for this patient. Once we get all the data, and all the data will be aligned once we export it out, and we can send it to the lab to let the technicians to design the temporary teeth for this patient. And now we need to do the actual manufacturing for the temporary. This is a step of the actual design process for this case. Once we imported all the data inside it, all the pre-aligned and also the soft tissue, the bite, the jaw relationship, and also the implant position will be automatically transferred to this design stage. And we need to cut the CAP scan bodies out before we start the actual design process, and then to let the lab to finish the whole designing for this patient. And once the design is finished, we can receive or let the lab technicians to send back the design data, and once we received, we can start the manufacturing process on the chair side. For this case, we are using the F1 printer to do the printing for the temporaries of this patient. So we can do some layout to add some support to it, to do some small adjustment, and then AccuWear will slice it. Once the slice is done, you can send to the printer to do the printing. For this case, this one single arch took 15 minutes to finish the whole printing. And once it's printed, you can see this is the printed result on the right side of this page. Once the printing is done, this is the post-processing steps. So we will do some post-curing for the provisionals. As you can see from this video here, we are using the nitrogen curing unit to cure it. It took 9 minutes 30 seconds to do the first curing, and then remove the supports and then do some polish to grind some support on the surface of the occlusal side, also on the temporary teeth. Then we will add some gingival color on the gingival area for this patient, for the temporary, to make sure it looks good. And then we can do some stain and glaze to it using the tools. And after that, this is how it looks like. And then we put the models back to the nitrogen curing unit and to add nitrogen inside it to do aesthetic mode 30-second curing. So the first curing process we showed on this video is just a normal curing, and on this stage we add a nitrogen in and to do a 30-second aesthetic curing for this model. So this is the final result, and you can see it on the right side of this page. So this is a polished look after the nitrogen curing. Once we manufactured it out, on the chair side, we will put it inside the patient mouth to do a fitting and also to do some occlusal adjustment. For this case, minor occlusal adjustment is needed because all the data we captured to make sure we achieved a very ideal bite relationship for this patient. As for the removable denture, I already mentioned that the steps are the same with the immediate loading ones. If there is no bite at all for this kind of patients, we still need to use the optimal jaw relation to get the relationship of the both of the upper and lower jaw for this kind of patient to help with the design. So this case is a real case that we collected as well. We're using the optimal jaw relation function to get the bite for this patient, and then once we get the bite data and as well as the intraoral scan data, we send it to the lab and to let the lab to finish the design and then manufacture it out to deliver it to the patient. And also we tested the try-in for this patient, as you can tell from the pictures we displayed on this page. So the try-in result is very good and very ideal. Also, minimum occlusal adjustment are needed for this patient as well. So here is a long video shows the full process for the removable denture workflow using the jaw motion module. At the very beginning, we need to do some motion tracker fixation. So we have a 3D printed occlusal recorded base and also a motion tracker using the temporal resin stick on the base that we created, and we are using this temporal resin to make the motion trackers stably fixed on the base that we created, and then we will put it inside the patient mouth to see the fitting and also make sure the things we put inside the patient mouth won't block the natural movement of the patient upper and lower jaw. Well, lower jaw. And after that, we can repeat the same step to put the rubber features on the motion tracker for the upper and the lower jaw separately. and make sure you're using 2 different colors for the motion tracker in order to let the software to recognize which is upper jaw and which one is the lower jaw. And once all the rubber features are fixed, we can use some temporary resin to cement the lining part, not lining parts, but the meeting lines of the rubber feature with the main part of the motion tracker to make the rubber features are stably sticked to the motion trackers in case that it might fall off during the capturing or tracking movement. So on this step, we are using the markers to put it on inside the dent, to pre-make dent on the rubber feature. Then we apply some material inside the fitting surface of 2 different trays and to put it on the patient mouth in order to get it stably sticked on the surface of the patient upper and lower jaw. Once it's cured, we can trim it to increase the comfortability while we're putting it inside the patient mouth, doing the tracking for the jaw motion. And then we apply the same material to the lower jaw and repeat the same steps again to put it inside the patient mouth and to wait until it is cured and to trim it to make it more comfortable while we are putting it inside the patient mouth. So we are repeating the same steps to press it down to the patient lower jaw, and once it's cured, do some trim the materials and the trays to increase the comfortability while putting it inside. Then we can do an extra match for the motion tracker, and also this is for the upper jaw scan. Once the upper jaw scan is finished, we have to get all the feature points that we may need for this patient. Once the upper jaw finished, we can do the scan for the lower jaw, and once we get all the feature points that may be useful for us, we can jump to the next step, that is to align the motion tracker with the upper and lower jaw we just scanned. Then we can use the extra match on the right upper right corner to scan the tray, also the front side of the motion tracker. And then once we finish scanning, the tray is a little bit much more trickier than the normal scanning. It's because we have to scan the fitting side of the tray and then move it a little bit in order to get the front side of the motion tracker to scan it. So only the fitting side of the tray is needed to be scanned in order to help with the alignment with the patient mouth. And then the same applies to the lower jaw, to rotate it a little bit in order to get the front side of the motion tracker, and then finish the scanning of the motion tracker, front side of the motion tracker for the lower jaw, and then alignment for the lower jaw as well. Then we can instruct the patient to do open and closing practice before we put the trackers inside the patient mouth. Then we can place both the upper and lower jaw motion tracker, the tray base connected with tray base inside the patient mouth, and to let the patient to do some movement to see whether it is good or not. Just make sure the trays and trackers are not blocking the patient while they're doing the motion, while they're doing the small closing and opening movement. Then we can get into the face scan stage to do the actual scanning. So this is the static face scan. It will recognize the marker first and then to do a zero position set. So you can use it, or using the facial proportion method to pre-select the zero position or the vertical distance for this patient. And once the static face scan is done, it will automatically do a automatic alignment between the upper and the lower jaw motion tracker. Sometimes if the automatic alignment failed, you can always choose a manual alignment, so you can pick different feature points to align them together and relax the muscles of the patient and put some the dentist put 2 fingers inside the patient's mouth in order to make sure the patient won't bite too deep for the movement, and in order to make the patient doing small and closing and opening movement for this kind of case, and also track for over 30 times small and closing movement, then we can remove the motion trackers along with the base, and then we can do a resting face scan. And for this patient, once the resting face scan is done, we can use the resting face to set the coordinate system that can help us to do the adjustment for this patient. And some alignment, some coordinate system setting, the A point, B point, the highest point and the lowest point, and then the coordinate system is done. And we are using the pre-designed interface to help us to adjust the jaw relation. So we have the vertical dimension and also the horizontal relationship between each other. So we preset the vertical dimension at the very first 0 position scan. Then we use using the section mode to check whether there is enough distance for us to design the prosthesis for this patient. And after that, all these kind of things has done, and we can send it to the lab to design the removal denture for this patient. This is the end of today's webinar. Thank you for your attention and support, and I'll see you soon.